Next speaker is Eve Stoody, and she's going to be speaking on what the patterns of dietary intake across the lifespan are and what are the opportunities to support healthy aging. Dr. Stoody is the lead nutritionist of nutrition guidance at the Center for Nutrition Policy and Promotion at USDA in Washington. And CNPP works to improve the health and well-being of Americans by developing and promoting dietary guidelines that link scientific research to nutrient needs of consumers. And one of her primary assignments is to support the Dietary Guidelines for Americans revision. Prior to this, Eve worked as a lead analyst in the evidence library, where she served as a project manager for the Dietary Patterns Systematic Review Project. Eve, would you come up and give us your wisdom? And thank you very much.
Thank you. So, as was mentioned, today I'm going to talk a little bit about the 2015-2020 Dietary Guidelines for Americans, and then I'm going to talk about dietary intake across the lifespan in relation to these recommendations, and then finally discuss some opportunities for the future. So as many of you know, USDA and HHS work together to release a new edition of the Dietary Guidelines every 5 years, and we've been doing this since 1980. The latest edition was released in January of this past year. And the Dietary Guidelines make recommendations about the components of a healthy and nutritionally adequate diet to help promote health and prevent chronic disease for current and future generations. Now, the current edition includes 5 guidelines, 13 key recommendations, and it's 144 pages long. So I will just say I'm going to, in the interest of time, kind of focus some of the discussion around lifespan and around dietary patterns. And lifespan is really at the core of the dietary guidelines. And in Chapter 1, we state that the goal of the dietary guidelines is for individuals throughout all stages of the lifespan to have eating patterns that promote overall health and help prevent chronic disease. In carrying on this kind of focus on lifespan, the very first of the 5 guidelines is to follow a healthy eating pattern across the lifespan. And for those of you who aren't familiar with this edition, we continue to talk about components of the diet, but in this edition we're really have an increased emphasis on thinking about dietary patterns as a whole. So it's not just focusing on the individual components of the diet, but how they all fit together in an overall pattern. So the dietary guidelines describe adaptable eating patterns, and by this I mean it has some core elements, which I'll talk about, which parallel what were just discussed, but it has some core elements that can then be adaptable based on age, sex, physical activity level, personal preferences, and other factors. So the recommendation is to consume a healthy eating pattern that accounts for all foods and beverages within an appropriate calorie level. And a healthy eating pattern includes a variety of vegetables from the subgroups that you see here, fruits, especially whole fruits, grains, at least half of which are whole grains, fat-free and low-fat dairy, a variety of protein foods, oils, and a healthy eating pattern also limits saturated and trans fats, added sugars, and sodium. And there are some specific quantitative limits regarding added sugars, saturated fats, and sodium, which you see here. Consume less than 10% of calories from added sugars, less than 10% of calories from saturated fats, less than 2,300 milligrams per day of sodium, or the age-appropriate dietary reference intake, tolerable upper intake level. And if alcohol is consumed, it should be consumed in moderation, up to 1 drink per day for women and 2 drinks per day for men. So how are we doing in meeting these recommendations? And yesterday there was a presentation and the HEI was mentioned. And so this is a look at HEI over several different cycles of NHANES. And the blue bar at the top showing the max HEI score, which is a score of 100. And we see for the last several cycles of NHANES, when we look at individuals 2 years and older, average HEI scores are around 58. And so there's obviously a lot of room for improvement. When we break this up a little bit and look at different age groups, we see that the bottom line being ages 2 to 17 years of age, then 18 to 64 and 65 and older, you see that there is some variability across different stages of life. And I'm going to break that up even in more granularity in just a minute. But the point being that there is some difference across the different stages of life and how we are doing in meeting recommendations. So this is a slide, instead of just thinking about one number, looking at the different components of the diet. And so here on this slide, there are vegetables, fruits, total grains, dairy, protein foods, oils, added sugars, saturated fat, and sodium. And this is the percent of the U.S. population 1 year and older who are at, below, or above each dietary goal or limit. And the bottom line here is that for those, the orange bars represent the percent of the population who is not meeting the recommendation. So, for example, with vegetables, about 90% of the population does not meet the recommendations for vegetables. It's very similar for dairy, slightly better for fruit. And similarly, about 70% of the population is not meeting the recommendation for added sugars and saturated fat, and more for sodium. So the point being that we have a large percent of the population who does not meet these recommendations. So again, let's drill down a little bit further. And so what I'm going to do in the next several slides is show the same base slide. So I'm going to spend just a minute kind of orienting you to this particular, this figure. So this is looking at vegetable intake. The left-hand side of the figure is looking at intake of males, and the right side is females. And as I said, the recommendations, so we have these core recommendations, but they vary based on age, sex, and level of physical activity. And so what you see here is the blue bar is showing the recommended amount for males and females across different age groups. And so it may be a little difficult to see, but that there's age groups, for example, 1 to 3-year-old, 4 to 8-year-old, and so on, up to 51 and 70, and then 71 and older. So the point being here that we do say, vegetables are a key part of a healthy dietary pattern, but it's not that everyone should have 3 cups. There's obviously variable recommendations based on the age and sex of that individual, as well as their physical activity level. In all of these slides, too, there is an orange dot, and that orange dot represents average intake for that particular age sex group. So we said here in the last slide that 90% of Americans are not meeting the recommendation for vegetables. This is how far their average intake is from that recommendation. And so obviously we want that orange dot to kind of be up close or within the blue bar. So that's kind of an orientation to this figure overall, and now I'm going to show you a lot of them. So this slide, and I intentionally put it all kind of on one slide because to continue to think about dietary pattern as a whole. And so thinking about it collectively rather than just focusing on the individual pieces. And so for the next 3 slides, we'll have at the top that you see vegetables, fruits, and dairy. The middle section has total grains and protein foods, and the bottom of the slide has sodium, added sugars, and saturated fats. So just kind of saying some general comments about this. One, you can see just as recommendations change over the course of the lifespan, so does average intake. So we kind of see that at different stages of life, there are certain components of the diet that are of greater concern or we're better at meeting recommendations than at other stages of the life. So there's variability both in recommendations as well as average intake. We can also see that for the components of the diet up top, vegetables, fruits, and dairy, we can say generally those are areas that we need improvement, that average intake is below the recommended intake. This center section, total grains and protein foods, we can see that generally intake, that orange dot, falls within the recommended range. Now I will say, although not shown here in the dietary guidelines, it does talk about how intakes of whole grains, total grains is within kind of that recommended range, but whole grains is really low. Similarly with protein foods, we see that in general we're doing pretty well at meeting protein food recommendations, but there are subgroups within the protein foods group, and we'd like more variety within protein foods, for example, more seafood and more legumes. And then at the bottom, in terms of sodium, added sugars, and saturated fats, we can see that we are generally high in those components of the diet, and particularly for sodium and added sugars. So now what I'm going to do is highlight a few different age ranges just to kind of highlight some differences across the lifespan. And so here you should see that I've highlighted our youngest eaters, so in this case 1 to 3-year-olds, and you can see that generally their intake is pretty close to recommendations. There's not a lot of white space between. In many cases, the orange dot falls within the blue bar, but generally when it doesn't, we're not that far off from the particular recommendation. So our youngest eaters are kind of in a pretty good overall healthy eating pattern. Now then we move into adolescence, and in adolescence, and this isn't new information, adolescence, that's where things kind of seem to fall off. And so we see that the white space between the recommended intake and average intake is, in many cases, quite large. And so, for example, we see that vegetable and fruit intake is low in both for males and females. Dairy is particularly low for females in this age group. And then added sugars is a component of the diet that is particularly high for adolescent, both males and females. So adolescents, younger children, we're doing pretty good. Adolescents, things get a little crazy. And then when we get into older adults, we're moving back towards more healthier eating patterns. And so they are still low in vegetables and fruits, but the gap is not quite as large. Dairy is an area that is consistently lower than recommendations, and I know there's a lot of conversation about that recommendation, but currently intakes are quite a bit lower than what is recommended. And similarly, total grains and protein foods are quite near recommendations, and things like added sugars and sodium are not as big a concern in this population. So the point being that there is some variability across the lifespan in terms of how individuals are meeting recommendations. So in kind of some summary statements, most Americans need to shift intakes to achieve healthy eating patterns. Some of these needed shifts are relatively minor. We're not that far off from recommendations, and so these can be accomplished by making simple substitutions, while others are really going to require greater effort to accomplish. And young children and older Americans generally are closer to recommendations than are adolescents and young adults. Now, in thinking about opportunities for the future, I'm going to highlight just 3 points. One is the future for implementing the dietary guidelines, which was referenced here in the previous presentation. Thinking about the future of the recommendations for the dietary guidelines, and also thinking about future research opportunities. Okay, so this is a slide that I showed a few minutes ago looking at HEI scores at different stages of life. And I think a goal of ours is to improve the intakes of young children, and maintaining those intakes as children grow into adolescence and adulthood could result in healthier eating patterns across the lifespan and subsequently improved health over time. But how do we go about doing that? I think there was a presentation yesterday morning that said, we keep telling people to eat healthier and it's not working. And it really is a much bigger conversation. Everyone has a role in helping to create and support healthy eating patterns in multiple settings nationwide, from home to school to work to medical care to communities. And the dietary guidelines do include a socio-ecological model, and talks about how there are multiple areas in which change can be supported. And that's not only at the individual level, but also within settings and sectors and social and cultural factors. So there are many different places that need change in order to really support comprehensive change in overall eating patterns. One of the ways that we do this within the federal government is through Choose My Plate, which is an icon that is used to help support and promote healthy eating. And I will say that there are a number of materials that are available through My Plate that for different ages and stages of life, including preschoolers, kids, and older adults. There's a lot of collaborative work that is being done across the departments, particularly USDA and HHS, to support healthy eating across the lifespan. And one of those initiatives was a collaboration with CMPP and the National Institute on Aging to create some materials such as this 10 tips sheet for healthy eating for people ages 65 and older. So there are some opportunities to take the dietary guidelines and tailor materials for your specific target population, whatever that stage of life may be. The National Institute on Aging, I just wanted to note, does have a Go for Life program that does include materials that can be used to help support healthy eating in settings and communities and other components beyond just individual behavior change. Okay, now I'm thinking about the dietary guidelines. The dietary guidelines have traditionally included recommendations for Americans ages 2 years and older, and there's really been a growing demand for many years now to expand the guidance to include the birth to 24-month population. And some of you may know that the Agricultural Act of 2014 mandated that we would include the birth to 24-month population as well as women who are pregnant in the 2020 edition of the dietary guidelines. So the next edition of the guidelines will include more focused or more comprehensive guidance for these particular stages of life. But I do think it brings an important and interesting point to the conversation are there other stages of life where we should do more comprehensive guidance? And is older adults one of those particular areas? So I think there is a future for thinking about the dietary guidelines more in a lifespan, life stage conversation, and what are those areas of focus that would be important to address. I will say that previous editions of the guidelines, and just thinking about older individuals specifically, the dietary guidelines do apply to older individuals generally, but over time, from 1980 to present, we have had specific guidance statements for older individuals, and those are kind of highlighted here. But again, should there be more? Should there be some sort of comprehensive guidance? And I think that's a conversation that we should have as this continues to be a topic of interest and importance. In terms of future research, as I noted, this edition of the Dietary Guidelines focused on dietary patterns. The evidence base that was considered to inform this edition looked at dietary patterns in various health outcomes, some of which were also just mentioned: cardiovascular disease, body weight, type 2 diabetes, certain types of cancer, bone health, depression, dementia, cognitive impairment, and Alzheimer's disease. And there was varying amounts of evidence for some of these different outcomes. But in general, more evidence is needed. Most of the dietary pattern studies did include participants who were 50 years and older at baseline and then followed them for 10 years, but there's still a gap of understanding how dietary patterns across the entire lifespan contribute to healthy aging. In terms of dietary patterns, there's a need for improved methods for assessing dietary patterns, and a lot of that work is underway. Stronger methodological design studies, so for example, longer duration of follow-up, looking at dietary patterns at multiple time points over the course of the studies, and also, again, just establishing cohort studies that start earlier in life in order to capture dietary patterns and health outcomes later in life. So with that, I think that there are just a lot of opportunities, both in terms of what is being recommended, the state of current nutrition research, and the opportunities for implementing the dietary guidelines and improving healthy eating across the lifespan. So with that, I am happy to take any questions.
Thank you.